Thank you so much, and good morning from New York City with sub-zero degrees. Just came back from wonderful Nairobi, and already I miss you guys. So thank you, and I'm looking forward for the next 20-minute presentation and time for questions and answers. I will share my screen now, and can everybody see this? Okay.
Yes, we can.
Great. So I wear many hats, and I'm a proud advisor to Ada Labs and the AI Center of Excellence. And again, congratulations on the amazing launch. And today we'll talk about one of Ada Labs' products, which is AfyaRekod. And I have had the opportunity really to go over multiple digital solutions, and I just want to share with you a little bit about what's going on and what are the global trends in digital health. So I started with this very provocative a slide by showing basically that investment in digital health is exploding, at least in the United States. If anything, COVID has accelerated the use of digital health, and it has become one of the most lucrative industries and the most sought after investments. However, this slide is a bit misleading because this is a culmination of at least 10, if not 15 years of technology work in the market. And behind this number are multiple companies, telehealth companies, insurance companies, chronic management disease companies that are now going to public offerings. But you can see here that in around over 450 deals last year, of an average of anywhere between $3 to $30 million per deal, there has been an investment of over $14 billion, which is an exponential growth from previous years and double to that we've seen in 2019. So if anything, COVID has accelerated the interest in digital health. Now, the question, of course, to the audience is, what does that have to do with us? You can see here that the investment in Africa in the healthcare sector is orders of magnitude smaller than that we see in the US and in Europe and Asia, and only represents a fraction of 1% of either venture capital or private equity investments. Nonetheless, the opportunity areas remain the same, and they pertain to the care provision, health insurance, and of course the integration of digital technologies. Now, it is clear that the African continent is different, and that the solution that you'll see today is contextually sensitive to the marketplace that is where there is scarce access to hospital, there's a limited data infrastructure, and no portable data. And what I hope you'll come out of this conversation is really to be inspired and to understand that digital transformation starts in Africa, by Africans, for Africans, with products that are done in place, such as AfyaRekod. But before we start, I just want to make sure that we all agree on what is digital health and that we have a consensus on what that represents. Now, the WHO defines digital health as a convergence of both digital and genomic technologies, where there is a connection also to what we call the social determinants of health that pertain to living and well-being. So it is almost like a marriage that has two sides to it. One is a system side that helps reduce inefficiencies in the delivery and improves access while reducing cost and improving patient outcome. But on the other hand, also this dream or this wish to empower people to use their data for actionable information and insights so that they can better track and manage and improve not only their own, but also their family's health. And this is not a definition that came out of a vacuum. It has been going on for the last 50 years with the use of telecommunications, the internet, the genomic revolution in 2000, and it's a convergence of multiple technologies that you see here that are all in the wish to detect, diagnose, and treat as well as prevent both acute and chronic lifestyle diseases. So when we talk about digital health, we talk about multiple technologies that are together that have reached to a substantive level of maturity. So we shouldn't see digital health as a technology, but rather as an ecosystem. And this is where AfyaRekod really has succeeded, not as a solution or even as a platform, but really an end-to-end ecosystem, which allows patients and providers, and I will talk later on a little bit about other stakeholders, to integrate care within that ecosystem. So digital health would include what is traditionally known as M-health or mobile health. And it's clear that the advent technology and penetration of the use of mobile phones in our life as hardware has been a huge bridge to use these type of digital solutions. We're talking about wearables and these type of technologies like Fitbit and Oura rings, and our ability to capture passive signals that can tell us our state of certain biological parameters like temperature, blood pressure, respiration. And of course, what has really boosted forward through the necessities of the COVID pandemic is really the remote monitoring through telehealth care, which is to a large extent a little bit of what we're doing right now through this Zoom meeting, this ability to speak from afar, transfer information that is valuable, and use with it different types of data that later on can be visualized and analyzed for the betterment of our health. So at the end of the day, all these technologies basically want to deliver four things. One is smart care, and everybody understands the lack of smartness when we are asked to do a test 1 week after the other, or when there's a lack of interoperability, or there's a lack of coordination between different services. We speak of smart care also when we receive information that is pertinent to our condition. So the ability, for example, to gain a medical literacy or know about our diseases through push notifications or public health policies through our phone is part of that expectation that we have with smart care. A second element, which I'm sure John will talk about and is key to the ability of AfyaRekod to provide portable data, is care anywhere. That today care needs to be done, as John says, at home and not in the hospital. Treatments perhaps in the hospital, surgery, chemotherapy, radiotherapy, things that need to be done in a protected environment, but where we want to have our care and our well-being tendered is at home, around our family and friends and our support systems. We want our health enterprises, be it at a clinic level, be it at a hospital level, be it at a government level, we want them to be intelligent. We want them to be responsive while they keep our data secure and private. And most importantly, and this is a topic that is near and dear to me, is empowered, where we really have the driving seat of where we are responsible and responsible to maintain our health as well as our well-being. So when we talk about these technologies, there are behind it three core technologies. One is telecommunications, especially now with the 5G coming out, be it telemedicine that sometimes is called telehealth, that speaks to long-term care monitoring and video peer-to-peer consultations. Or it could also be in smart homes or using cameras and monitoring falls and activities, especially as the population is aging. The Internet of Things, which is basically the internet or the connectivity of the machines that we use, the different sensors that we wear on us that can connect to medical apps. and the ability to take all this information that exists and through artificial intelligence and machine learning provide the necessary insights that allows us to act correctly on maintaining our health. And I'll be amiss to say that, of course, blockchain, a technology that I call is the software solution to the, I would say, social problem of trust. It allows us to make sure that the data is not tampered and can be traced and audited, something that we call computational trust. It is secure and encrypted, so it is both attack and collusion resistant, which is very important. And we all read about the various hacks that are happening on our private health information. And of course, the idea of privacy, privacy as individuals, but also privacy as companies and entities, which allow new ways to collaborate and provide better, bigger, and more accurate information. So where are we right now? As I mentioned, this is something that didn't start last week, and we are well past the age of learning where we're asking ourselves, why should I care? We all are familiar with these concepts, and if we are not, then I hope that this conversation will motivate you to go back and to improve your knowledge in these type of technologies that serve the backbone of digital health. And we are now really in the age of interest and the beginning of implementation. And it's needless to say that AfyaRekod is a stellar example of how there is an implementation of these technologies in a way that is useful and helpful for patients and providers alike. What will be interesting and where I'm looking extremely forward to through the AI Center of Excellence, as well as the soon to open Blockchain Center for Blockchain Development and Center of Excellence, is really how can we maximize this impact on each and every one of us. And so the reason why I'm excited is really that Africa will leap beyond that. So anyone who was depressed by the first two slides actually should be happy and excited that the lack of legacy systems, which is right now the number one reason why we are not advancing and moving forward in the implementation of digital health, is actually a huge advantage. The ability to move from paper-based health solutions on paper records, which of course are fallible, get lost, get corrupted, can all just jump towards the new digital health model, which is open source, which is integrated, mobile, and takes into consideration the social determinants of health. This is not to paint a dark color on what exists right now, but anyone who is familiar with the current systems that exist either in hospitals or in governments are very much familiar with the difficulties that it has, either by its user interface and user experience, or the lack of interoperability, or the data silos. And anyone who knows that, for example, now in the rollout of vaccinations of COVID, it is nearly impossible to enroll remotely using the current systems. So again, I cannot overestimate that. I am confident that in the 5 years to come, Africa will leapfrog beyond what is happening in the developed markets. And without any doubt, the systems that will be used will be better than the ones that we have here. And this is just an example. You see a picture on the left where in one of our non-run hospitals in Nairobi who have adopted AfyaRekod, they receive a digital identity management, so there's no more lost records or missed names or misidentifications. They have the capabilities to run records, not only their health records, but also financial records and insurance and claim records. They're able to take that data and to enroll either into clinical research or public health or any type of quality improvement and quality assurance processes, with also the ability to create surveys and actually monetize and encourage people to use AfyaRekod. And I'm sure that John will go over that. And of course, the ability also to manage inventory, to look at materials and to see medication, labs, and things that are tracked and avoid not only fraud and tampering, but also duplication and waste. So AfyaRekod is not only patient-centric. It's not only that as a person, I can consult with healthcare professionals via online appointments, and I can get reminders by text and emails or teleconsultations. It's not just the ability to access your personal information with other legacy systems, or to actually monitor this, your metrics with wearables, but it's to provide information that enables you to manage your own health and to connect to your family, to peers, to other apps, to get material that will allow you to maintain, not only prevent, but also maintain that state of health. More importantly, AfyaRekod is patient-driven, and that is an extremely important distinction, where the information that patients, and you see in the center of the circle, are provided by knowledge and adherence and self-testing and the reports themselves, where you can look at your diary and see how you're doing longitudinally, but also provides that information to healthcare professionals that can provide you the correct decision support and connect you to other health platforms and e-learning tools. But more importantly, it is the kernel or the nucleus of all what healthcare organizations and policymakers can actually do. And it's very difficult, if not impossible, for local governments as well as central governments to understand the state of the health of their citizens without understanding the state of the health of the individuals. So beyond the predictive analytics and the disease surveillance as we do now with COVID-19, it's really the idea of understanding what are the diseases that are posing a real burden on society. And we all know that there is a mismatch between actually what kills people and where the industry is investing their money. So this whole system that starts from you is going to be the system that nourishes the intelligence of all healthcare. And it is patient owned, it is yours. And so it not only promotes well-being and allows to deliver the correct type of healthcare, and it's a connected one, but also to pursue innovation through universities and research organizations, through technology partners and other professionals, including government agencies that are interested in promoting health. And this is exciting. I always explain that when I spoke in some European and African Union policymaking. I said health data, excuse me, health data and the way it is presented in AfyaRekod is like money. In other words, it is yours. It has value. You keep it secure in a wallet and you can access it whenever, wherever, for whatever reason. And because that information has value, you invest in it and that value accrues. And then afterwards, you can donate that either to family or friends, or you can also donate that to society at large as the general knowledge or the common knowledge that, that crowd intelligence that we all need in order to answer the future problems pandemics will provide us. And so my take-home message is that the data created by AfyaRekod is not only a reliable, a secure, and private source of data, but it is uniquely portable. It is owned by you and it can be monetized. And so despite the fact that there is very little that is going on in terms of financial investment in healthcare in Africa, revolution is starting exactly where it's supposed to. And I think we should all be proud and excited of what stays ahead. And as I was presented saying that eventually what we need is to transform ourselves from health service consumers that just want to test for every pest and a pill for every ill, to actually become health and wealth producers that live in a sustainable and equitable world. So I think we finished on time, and we have a few minutes for questions, and I'm looking forward to hear anything from the crowd.